Pleura and lung. The pleura, quick summary, thank you. The pleura consists of two layers, parietal pleura and visceral pleura. The parietal pleura extends into the root of the neck, lines the thoracic cage, forms the lateral margin, the mediastinum, and covers the diaphragmatic surface, the thoracic surface of the diaphragm. Therefore, it consists of four parts: cervical, costal, mediastinal, diaphragmatic. The visceral pleura is attached to the surface of the lung and extends into the interlobar fissures, the depth of the interlobar fissures. A cavity is located, slit-like space is located between the parietal and the visceral pleura, and that's the pleural cavity or space containing the pleural fluid, approximately 5 to 10 ml in volume. This permits the pleura, the pleurae, to slide over each other with minimum friction. The right lung is divided into 3 lobes by oblique and horizontal fissure, whereas the left lung is divided into 2 lobes by the oblique fissure. Each lung consists of an apex, يحتاج إن نمسكها ثاني ولا خلاص؟ An apex, costal surface, it has anterior border, diaphragmatic surface or base with inferior border, and it has a posterior border. Lines of reflections of both pleura and lung are very important so that we understand the costodiaphragmatic recess and costomediastinal recess. There are 4 recesses, 2 on each side. The inferior border of the lung descends into that space, that recess, during deep inspiration. The anterior border of the lung slits in and out of the costomediastinal recess during inspiration, expiration, respectively. The lines of reflection on the right side for the lung and pleura are similar. It starts from the chondroclavicular joint. We draw a line curved upward for about 1.5 inches above the clavicle. And if you want to be more accurate, it's from this joint to the junction between the medial and intermediate thirds of the clavicle. Yeah, this is the medial third, intermediate third, lateral third of clavicle. طبعا الكلافيكل ما هي موجودة. Okay? It's a line drawn to the junction of medial and intermediate thirds of the clavicle. The anterior border of the lung and the line of reflections of the right pleura starts from this joint by a curved line almost touching the midline at the sternal angle. Then it descends downward to the xiphoesternal joint. It's about 1 centimeter from the midline. Then comes the inferior border. It's drawn by an oblique line crossing the 6th rib at the mid-clavicular line, crossing the 8th rib at the mid-axillary line, and reaching the 10th vertebra near the vertebral column. For the right pleura, it is exactly the same, except the figures change. From 6, 8, and 10, now it becomes 8, 10, and 12, representing the costodiaphragmatic recess. On the left side, again, the apex is the same, whereas when we come to the anterior border, we draw a curved line almost touching midline at sternal angle, descending to the 4th costal cartilage, 2, 3, 4, 4th costal cartilage, then deviating laterally beyond the lateral margin of the sternum. And then drawing the line downward at the level and stopping at the level of the xiphoesternal joint. Note, the deviation for the pleura is less than that of the lung. Clear to everyone? Right. The oblique line is exactly the same. The inferior border is exactly the same for the lung and for the pleura on the right and on the left. These are the lines of reflection. The oblique line is represented by a line passing along the 6th rib from the root of the spine of the scapula, passing along rib number 6. On the right side, an additional line is at the 4th costal cartilage, crossing the oblique line at the mid-axillary line. These are the lines of reflection. Blood supply. The lung has both pulmonary circulation and systemic circulation. The systemic comes from the bronchial arteries, which are branches of the descending thoracic aorta. Each follow the bronchus and the bronchial tree as it divides. The drainage is by veins leaving the root of the lung and draining into the azygos and hemiazygos, on the right and the left respectively. That's the systemic circulation. Pulmonary circulation, it comes from pulmonary artery, which is located within the bronchopulmonary segment and drained by 2 pulmonary veins from each lung, draining into the left atrium. A bronchopulmonary segment is a division of a loop. So each loop consists of number of segments. The segment is pyramidal in shape. Its base is located at the surface of the lung. Its apex directed towards the root of the lung. They are separated by connective tissue. This connective tissue contains the pulmonary tributaries of the pulmonary veins. In the center of each segment, we find the segmental bronchus and its division. It divides into 16 generations. The smallest is the bronchiole, which is about 1 millimeter. Then the terminal bronchiole. Finally, few alveoli start to appear on the division, forming the respiratory bronchioles, which divide into alveolar ducts, alveolar sacs, and the alveoli. It is at the alveolus level where gas exchange takes place. The unit is important because it could be removed. Any damaged unit or diseased unit can be removed surgically without affecting the other units. Important to note, pulmonary arteries in the center, pulmonary veins are in the connective tissue. Regarding innervation, the parietal pleura is innervated, the costal is innervated segmentally by the intercostal nerves. The mediastinal pleura, parietal pleura, is innervated by the phrenic. The diaphragmatic pleura is innervated by the phrenic on the central part and by the lower 6 intercostal nerves on the peripheral part. Regarding innervation of the lung is innervated by pulmonary plexus, and these, as we said before, sympathetic and parasympathetic. Sympathetic branches from sympathetic trunk, parasympathetic from vagus. And this similar innervation of the viscera. Note, the parietal pleura is sensitive to touch, pressure, temperature, pain, pressure, touch, and temperature, whereas the visceral pleura is sensitive only to stretch. Thank you. That's the innervation. Lymphatic drainage, 2 levels, superficial and deep. Superficial follow the counter of each bronchopulmonary segment to the root of the lung. The deep is by the pulmonary nodes, which also drain into the root of the lymph nodes located at the root of the lung. Bronchopulmonary nodes. Any questions? Yes.
Okay, the bronchial vein, it goes back with the bronchial artery the same way.
Yes, it follows the bronchial artery and it leaves the root of the lung. So let me now ask you, what are the structures located at the root of the lung, of each lung? عدوا لي الستراكشرز اللي موجودة at the root of the lung. يلا نبدأ بالبداية. البرونكس. Pulmonary arteries, pulmonary veins, lymph nodes, nerves. What else? قلنا nerves or lymphatics or blood vessels, bronchial arteries, bronchial veins, all these. So the root of the lung contains all the structures leaving and entering each lung. So how the lung is attached or fixed in the thorax, the lung.
Pulmonary ligament.
هل في ligaments attached للبرايتال؟ So the lung is actually ايش؟ It's actually free. Only one attachment it has. What stables the lung? The root of the lung. So the lung is only stabled by its root, by the structures entering and leaving the lung. It is held in position by the root only. واضح؟ ايش لون اللنج في اليونج people؟ New babies, newborn, pink. طيب, and as the person grows in age, it becomes darker. Phagocytes, dust cells of the lung, they become increased. What about people who work, for example, in mines, coal mines, مناجم الفحم؟ كيف حتكون؟ يا سلام. ومين بعد حتطلع بلاك؟ Smokers. Thank you. The lung, if I open the thoracic cage, okay, what will happen to the lung? Sorry? Collapse. It will immediately collapse to about 1/3 of its size. But what about accumulation of fluid, of the parietal fluid? What do we call that?
Pleural effusion.
Pleural effusion. Abnormal accumulation. And what causes this accumulation?
Collapse.
Inflammation, malignancy, congestive heart failure, all these can cause accumulation of the fluid. Thank you very much.